I am Vinita Singh. I'm one of the consultants at Portland Hospital. My specialty is looking after pregnant women who have medical problems in pregnancy. And one of the most common medical problems that we get during pregnancy is gestational diabetes. So, what is gestational diabetes? Gestational diabetes is a diabetes that you get during pregnancy for the first time. Who can get it? Almost any pregnant woman can get the gestational diabetes. However, some women are more at risk than the others. The women who are more at risk are women who have high BMI, women who have a very strong family history of diabetes, women who had gestational diabetes in their previous pregnancy, or women who are genetically more predisposed because they come from certain part of the world, for example, Afro-Caribbean countries, Middle Eastern or Asian countries. How do we diagnose it? It is diagnosed by a simple blood test that we do at 26 to 28 weeks. So what happens if you get gestational diabetes? If you get gestational diabetes, you should see an obstetrician who is experienced in managing women who have diabetes. So gestational diabetes is managed in a stepwise pattern. First, we try to manage it with diet and exercise. You may need to take oral medication called metformin, or you may need to take insulin. Both metformin and insulin are very safe in pregnancy for you and for your baby. What are the complications that can happen if gestational diabetes is not managed properly? The complication that can happen to you is that you can develop preeclampsia, which comes with its own sets of complication. For the baby could be very big. There could be a lot of fluid around the baby, and after the birth, the baby might need to go to the neonatal unit as they develop low blood sugar, jaundice, and may need some support for breathing. All these complications can be minimized by appropriate management of diabetes throughout the pregnancy. Will you need a C-section if you are diagnosed with gestational diabetes? Absolutely. Gestational diabetes in itself is not an indication for needing a cesarean section. However, if the baby is very big, more than 4 kilos or above 90th centile, we sometimes do recommend cesarean section because there's slight increased risk of shoulders getting stuck during the delivery. Will it affect your delivery? It might affect the timing of your delivery. We generally do not advise to go post-date if the mother has gestational diabetes. So you might need an induction before your due date or around your due date. What happens after the delivery? Gestational diabetes by definition is the diabetes of pregnancy. So once you're delivered, your gestational diabetes gets cured. But it gets cured for the time being. That means you are at high risk of developing gestational diabetes in your second pregnancy. Also, you will be at high risk of developing type 2 diabetes in your lifetime. Both these can be managed or reduced by appropriate lifestyle and diet. So I hope that this video has answered some of your questions of gestational diabetes. If you have diabetes of any sort or you have developed gestational diabetes, please see an expert who can make your pregnancy as safe as possible. I would be very happy to answer any of your questions if you have any further queries.